Okay, and we are live. Good afternoon, everyone. So good to see you all this afternoon. I'm Aparna Kumar. I'm one of the nerdy girls, not often on camera, so excuse me for that, mostly behind the scenes. I'm here today with Adrienne Griffin from the Maternal Mental Health Leadership Alliance. She is the executive director, here today to share her expertise with us. So I'll start out just asking a couple of questions to Adrienne. Um, Adrienne, could you tell us a little bit about your background, your interests in maternal mental health and MMHLA?
I know it's kind of a mouthful, isn't it? Sometimes
Yes.
yeah. Well, first, thanks so much, Aparna, for inviting me to be on the show with you today. I love talking about maternal mental health. It's a passion that's near and dear to my heart because when I had little children, I had a really hard time after one of my children was born. And this was 18 years ago. And like we think we don't talk about mental health now, but even then, it was still very taboo. And I knew right away that something was wrong, but it took me about 6 months to get help. And I kept thinking, it can't be this hard, right? I'm, well-resourced, I'm married, I have insurance, I have access to the internet, I live outside Washington, D.C. Why is it this hard to navigate the mental health system? And so I kept thinking, when I get better, I have got to do something about this so that other women don't go through what I went through. And I am not a mental health practitioner by training or anything. I just come to this from my lived experience. And then, once I got better, I started a support group at our local hospital. I mean, there was the Happy Mom support group. And when I was going there, I was like, where are the moms like me who need more help? So it turns out the woman who was leading the Happy Mom support group also had postpartum depression. So the two of us came together and we started this other support group for moms who were struggling a little bit. And that group is still meeting 18 years later. I'm so thrilled. It's been meeting for every 2 weeks. Slowly, I just kept doing more and more. Other people wanted to start support groups, so I trained them. And then we said, well, we have to connect women to mental health providers. So where are those? We found those, we trained them. And I built up a nonprofit organization in Virginia that I worked at, that I led for about 10 years until coming to the MMHLA about this time last year to focus on national policy around maternal mental health. So yeah, I'm a nerdy girl too, policy wonk, yeah.
We love nerdy.
And I love that expression, nerdy girls. I'm so impressed by all of you.
You're a nerdy guest, so thank you.
Yeah.
Tell us a little bit about MMHLA's work, even prior to the pandemic, and then maybe going into the pandemic.
Sure. So again, the Maternal Mental Health Leadership Alliance is focused exclusively on national policy around maternal mental health. And so what we're talking about is really sort of the childbearing years, during pregnancy and postpartum. So looking at all the range of mental health issues that women experience during that time frame. And we know these issues are the number one complication of pregnancy and childbirth, affecting at least 1 in 5 women that we know of. And so, like I said, I came to MMHLA about this time last year. And so really focused on the intersection of maternal mental health. And at the time, we were very focused on maternal mortality and how many women were dying in and around childbirth. And we saw, of course, that women of color and women who live in poverty are disproportionately impacted by issues of maternal mortality and maternal mental health. And that has been, of course, completely reinforced during the time of this pandemic, where we see women of color and disproportionately affected by the pandemic. And so like many organizations, COVID-19 came along and we did a quick pivot, right, to really incorporate this and focus on this. And we really see that women who are pregnant or are new mothers are really, really stressed and anxious, as you might imagine, right? You're pregnant and this new and nobody knows how it's going to impact you or your baby. It can be transferred to the baby in utero. I mean, so many questions. So of course, new moms and women who are pregnant are very, very anxious. And so we've been, working hard to help get information out about, what the impact is of COVID-19 on women and their babies. And of course, this is still just all unfolding, as well as really giving women tools and tips and techniques to deal with their anxiety and their stress during this time frame.
Mm-hmm. What do you think in terms of your priorities for the organization and just in your experience? You talked a little bit about how your work has pivoted. What do you think are the greatest challenges for women right now? And either on a policy level or individuals. I know many people frequent your site. Great information on your website as well for
Yeah.
individuals being able to learn about their own choices. What do you think is most important in terms of your priorities during COVID-19?
Gosh, that's such a huge question. I think the most
You can make
important
it
thing.
smaller if it's too big.
Thanks. So what I'll really pick up on is, what everybody can be doing to manage their stress and anxiety during this very uncertain time. And just some tips and techniques that I've heard a lot of psychiatrists and mental health providers put out about managing your stress. So for example, things like limiting the amount of input, right? Instead of streaming and listening to news all day, check news in the morning and check news in the evening, and then, take a break from it. Similarly, if you are prone to anxiety or to worrying, to give yourself set times during the day when you're going to focus on that anxiety and worry, and like write down your, whatever it is that you're concerned about, and then take your 10 minutes in the morning and 10 minutes in the evening for your worry time, and, go through your list and worry about it, and then try to put it by the wayside. And then the third tip for sort of managing stress and anxiety, particularly for women who are pregnant, is, to stay well informed. We know that pregnant women have, tons of questions, a whole Pandora's box of questions. Will they be able to have a support person with them in the hospital? If they or their baby are test positive for COVID-19, will they be separated? What's going to happen when they come home? Who's going to help them? To really try to stay as informed as possible. And I know that's easy to say with policies changing on almost on a daily basis. Any given hospital may have a set policy, but depending on what is happening that day, are there COVID-19 cases on the rise? What are they seeing in their ear? So policies will change. And then, fourth is really just to try to be flexible, right? I know, again, easier said than done, but, especially around the whole aspect of childbearing, during pregnancy and delivery, everything is really out of your control. And if you can just sort of, hopefully moms focus on the long run, which is having a safe pregnancy and having the baby being delivered safely, and that mom and baby are alive and can come home together. That's really, if we can just keep it kind of simple as what we're focused on, and instead of trying to control all of the little things.
Mhm.
Yeah.
Thank you so much. Are there specific things that we can do as individuals to help support moms with mental health issues, especially during this time?
That's a great question. And I think it's really important, if we know women who are having children and fathers as well, to ask them, how's it going? What can we do to help? And then say something specific. Can I send dinner over? Can I, we used to say, come watch the baby so you can take a walk. Can we do the laundry? Can we run some errands for you? Being very specific, so that mom, if you just say, what can I do? People are like, I don't know. But if you say something very specific, that could be helpful. Yeah. And it's tough because I remember all the things that would have been helpful, like, okay, can I take the baby so you can go for a walk or take a shower? Or, can I watch the older children so that you can be alone with the baby? Or, all of those things are tougher now. So I think people have to be a little bit more creative, but certainly, running errands, sending a meal, those things can be really, really helpful.
And you reminded me, I believe she was also at the webinar you were in on the congressional briefing. Dr. Lakshman, also Pooja Lakshman, has a great Facebook page. I don't know if they're on other platforms, but it's COVID maternal well-being. And
yes, I'm so glad you mentioned that. And a lot of the tips that I pointed out are things that I've learned from her. Yep.
Yes. Yes, and we've Nerdy Girls have linked to her site before too in some of our pregnancy posts, so you can find it there, and I can share it again.
I think that's a great idea.
One last question: are there specific areas that we can support on a policy level, either at the state level or federal level, that have become more emergent right now during this pandemic?
Absolutely. So one of the big things that I think we can really do is, Congress is considering another COVID-19 relief package with some more focus on mental health issues. And, they have been giving tons of money to the healthcare side of things, which I think is great. But, we know so many things now that people are really going to be suffering long-term from sort of the social isolation, from the trauma, the pandemic, all of those things. And of course, all the racial tensions that are going on. So to encourage your congressman or your senator to really fund a COVID-19 package that includes robust resources for mental health. And it's really easy. You just email them and say, please support mental health in the COVID-19 stimulus package. So yeah, and that's, a big one. We'll be sending out letters, and certainly we'll ask your group if they want to weigh in and sign on. We're always looking for people to help, fortify our message.
Wonderful. So to our followers, we'll share some of those resources as they come up. Thank you so much to Adrienne Griffin from MMHLA, and we'll look forward to seeing all of you soon. Stay safe and stay sane. Thank you.